Good morning. Myself Dr. Rohina Asma. I am senior lecturer in the Department of Prosthodontics. Today, I will be talking on the teeth selection in complete denture. So these are the content which I will be covering. Mainly, I will be covering the objectives of teeth selection and the anterior teeth selection, in which I will be covering the size of the anterior teeth, the shape of the anterior teeth and shade of the anterior teeth using various methods which is mentioned over here. So this could be your 10 marks question where they'll ask the various method, explain about the various method in the anterior teeth selection, and it could be your 5 marks or 2 marks question where they'll ask a particular method to select the anterior teeth. So the next step in the fabrication of the complete denture is teeth arrangement. After jaw relation and mounting is teeth arrangement. Before proceeding with the teeth arrangement, we need to select the artificial teeth. The selection of the artificial teeth is very important, as the selection of size, shape, color of the artificial teeth determines the aesthetic, the functional outcome of your complete denture. So, which are the objectives which you need to consider for the teeth selection? The first most, whenever you are selecting the teeth, you should make sure that the teeth which you select should be in harmony with the surrounding tissue, so that there is no tissue abuse. The second objective is being the selected teeth should be maintain the vertical height of the patient which was there in the natural teeth. Also, it should provide the efficient mastication, and it should be aesthetically pleasing to satisfy the aesthetic and functional requirement of the patient. So, the teeth selection in complete denture is divided into anterior teeth selection and the posterior teeth selection. So, whenever you are selecting the anterior teeth, you should give importance to the aesthetic of the patient, whereas the posterior teeth, when you are selecting the posterior teeth, you should give importance to the functional requirement of the patient. So, we have a different method to select the anterior teeth and different method to select the posterior teeth. Today, I will be covering the anterior teeth selection in complete denture. So, how to select the anterior teeth? There are 3 basic considerations to select this anterior teeth, which are what you have to see while selecting the artificial teeth is that you have to consider the size of the teeth, the form of the teeth and the shade of the teeth. So, let us see how to select the first factor, that is size of the teeth. So, we have the following method to select the size of the anterior teeth. So, you can select size of the anterior teeth using the pre-extraction records of the patient, using the anthropological measurement of the patient, and we have anatomical landmark. We can use the anatomical landmark of the patient and select the size of the anterior teeth. So, which are the pre-extraction records you can consider for selecting the size of the anterior teeth? You can consider the diagnostic cast, which is obtained before the extraction of the teeth and preserved. So, this will give you the information about the size and shape of the teeth. What you have to do here is simply you have to measure the mesiodistal width and occlusogingival height in the cast, the comparable size of the teeth you should select from the artificial teeth mold. Then we have a photograph, just pre-extraction photograph. So, this will provide you the information about, again, the outline form of the teeth and the width of the teeth. So, what you have to do here is you have to establish the algebraic proportion on the photographs as well as on the patient face, considering interpupil distance as a reference. So, with this proportion, you can determine your width or outline of the anterior teeth, size of the anterior teeth. Then we have a pre-extraction radiograph. Again, this will also provide you the information about the outline or length of the teeth, but the drawback of this record is because of the divergence of the X-ray, there will be a slightly enlarged image or distorted image. So, with that, you cannot accurately measure the size or shape of the anterior teeth. Then we have a preserved extracted teeth. This is the best and most reliable method among all the pre-extraction records. So, with this, you can accurately measure the size and shape of the anterior teeth. If you don't have any available pre-extraction record, which I have mentioned previously, then you can go with the other method. That is, you can consider teeth of the close relative, such as the patient daughter's son or the patient daughter or son. Teeth can be taken as a reference for selection of the size of the anterior teeth. If at all you don't have any available pre-extraction records, neither the pre-extraction records of the diagnostic cast or which all I have mentioned, or the patient daughter's son, if you don't have those records, then you can proceed with the other methods such as using the anthropological measurements or using the anatomical landmarks of the patient. So let's see the method using the anthropological measurement. What is anthropology? It's nothing but some authors have done studies on the ancestors of the different parts of the body, and they have measured and they came out with certain formula. That formula they have used to determine the size of the maxillary anterior teeth. So we have three different methods such as the anthropometric cephalic index, Berry's biometrics, and Pond's formula. So anthropometric cephalic index was given by Sears. So what he has done, he has measured the transference circumference of the head at the forehead level using the measuring tape. Then he has used this measurement and divided with a 13 to get the width of the upper central incisor. So what is the formula here to get the width of the upper central incisor? That is the measurement of the circumference of the head divided by 13 will give you the width of the maxillary central incisor. Then next we have Berry's biometrics index. What he has done, he has measured the bizygomatic width, that is the distance between two zygoma, and he measured length of the face, that is distance between the hairline and tip of the chin. Then he divided both the measurement with the 16 and 20 to get the width of the central incisor. So the formula to get the width of the central incisor is bizygomatic width divided by 16, length of the face divided by 20. Then we have a Pond's formula. Again, he has same measurement, that is bizygomatic width and length of the face, and he divided both with the 16 to get width of the central incisor as well as length of the central incisor. Hope this is clear. Then we have other methods using the anatomical landmarks of the patient. We can use landmarks such as the size of the maxillary arch, or location of the canine eminences, location of the buccal frenum. Then we have a nasal width and intercanthal distance as a guide. So how to select the size of the maxillary anterior teeth using the size of the maxillary arch? What you have to do, you have to just locate the incisive papilla and the hamular notch on the cast, then measure the distance between the incisive papilla and the hamular notch on one side of the cast. Then you have to add that distance with the distance between the two hamular notch. So basically what you have to do, the distance between these two arms will give you the distance, or it will give you idea about the width of the both maxillary anterior teeth as well as the posterior teeth. Then we have a canine eminence as a guide. You have to locate the canine eminences on the cast, then measure the distance between the canine eminences along the ridges using the flexible ruler or using the thread. That distance will give you the idea about width of the maxillary anterior teeth. If the canine eminences are not prominent, then we have a other method. What you have to do, you have to insert the fabricated maxillary occlusal rim in the patient's mouth. Then using the floss, as it's seen in the image, using the floss, the line running from the inner canthal of the eye to the eye of the nose is extended on to the maxillary occlusal rim and marked. And same thing has to be proceeded on the other side. Then the maxillary occlusal rim should be taken out of the patient's mouth. The distance between those marking has to be measured. So that will give you the idea of the maxillary anterior teeth width. Then the Boucher and Hoffman et al. Has considered nasal width as a guide. What they have done, they have measured the distance between the eye of the nose using the vernier calipers, and they stated that this will give you the idea about width of the maxillary anterior teeth. There's one more study done by the Mauskoffi and the Rishi. They have given a formula where A is equal to n plus 7, where n is nasal width, to which they have added 7 to get the combined width of the maxillary anterior teeth. Then inner canthal distance as a guide. What is inner canthal distance? It is distance between the two medial angles of the palpebral fissure. The Abdullah has done a study in the year of 2002. What he has done, he has measured the inner canthal distance of the various patients, and he found that the inner canthal distance was greater than that of the central incisor. So what he did, he multiplied ICD with a 0.618, where ICD is inner canthal distance. He multiplied ICD with a 0.618, then the resultant product he divided with a 2 to get the maxillary width of the central incisor. So what is the formula to get the maxillary central incisor width? That is ICD multiplied with a 0.618 divided by 2 will give you the width of the central incisor. So this is all about to select the size of the maxillary anterior teeth. So those are the methods which you have to consider to select the maxillary size of the anterior teeth. Then we have a second consideration, that is form of anterior teeth. To select form of the anterior teeth, again we have a different method. You can consider the pre-extraction record. The same pre-extraction record which I have explained before can be considered for selection of the shape of the or form of the teeth. Using the pre-extraction record, we can select the size or shape of the maxillary teeth, but not the shade of the teeth. To select the shade of the anterior teeth, we have different methods. Then the second method to consider the form of the anterior teeth is dentogenic concept. It is also called as an SPF factor. Then we have a facial profile and the facial form as a guide to select the form of the maxillary anterior teeth. To how to select using facial form as a guide to select the form of the anterior teeth. So we have a concept called as Leon-William concept. So what he believed in his concept was there is a relationship exists between the shape of the teeth and shape of the face. So he stated that the shape of the teeth should be inverse of the shape of the face. What does he mean here was, if for example the patient is having the face which is tapering downward, then the teeth should be tapering upward. So based on that, he has given 3 different types of form of the teeth, that is the square, tapering and ovoid. So in case of square and the combination of the square tooth facial form, you can select the square tooth form, whereas the patient with a tapering and the combination of the tapering facial form, you can select the triangular tooth molds. Then in case of the ovoid and combination of the ovoid facial form, you can go with the oval tooth molds. So to determine the facial form of the patient, we have some indicator that is called as a true by tooth indicator. So this indicator we can use to determine the facial form. This indicator has a vertical line on top of that and the central piece cut out at the center to stabilize the indicator on in the front of the patient face. So how do you determine? So you have to just keep this indicator in front of the patient face and check for the outline of the face. If the outline of the face is running along with the vertical lines of the indicator from the forehead to the jaw, angle of the jaw, then that indicates the patient is having square kind of facial form. If the outline of the face is running at the upper two-third, it is following the vertical line of the indicator, and lower two-third, the outline is getting tapered from the vertical lines of the indicator. Then that indicates the patient is having square tapering kind of facial form. If the outline of the face is running, which is tapering from the forehead to the angle of the jaw from the vertical lines of the indicator, then that indicates the patient is having the tapering kind of facial form. If the patient outline is curved against the vertical lines of the indicator, then that indicates the patient has the curved ovoid kind of the facial form. So this is how you determine the facial form using the 2-by-tooth indicator. Then we have a facial profile as a guide to select the form of the teeth. We have a different facial profile such as a straight and curved. In case of a straight facial profile, we are going to select the straight labial surface of the maxillary anterior teeth, whereas in case of the curved facial profile of the patient, we are going to select the curved or contoured kind of the labial surface of the maxillary anterior teeth. Then the other method to select the form of the anterior teeth is dentogenic concept, which was given by the Fresh and Fisher in the year of 1956. This concept is also, what is dentogenics here? It is art, practice and technique of creating the illusion of the natural teeth in the artificial dentures. So this technique is based on the SPA factor, where S stands for the gender of the patient, that is sex, P stands for the personality of the patient, A stands for age of the patient. So according to this concept, the shape of the teeth differs in male and the female. So let's see which are the features which makes difference in the male and female teeth. So when you see the angle of the incisal angle of the anterior teeth, it is more rounded in case of the female, whereas in case of the male, it is less rounded. When you see the angulation of the teeth, it is less rounded, less angulated in case of the female patient, whereas it is more angulated in the male patient. When you see the incisal edges of the maxillary anterior teeth, in case of the male, the incisal edges are parallel to the curvature of the lower lip, whereas in the females, the incisal edges will follow the curvature of the lower lip. Then the lateral incisor. When you see the lateral incisor, the mesial part of the lateral incisor, in case of the female, it is more ahead when compared to the central incisor, whereas in case of the male, the mesial part of the lateral incisor is hidden by the central incisor. So this feature will make canine more prominent in the male than in the females. Then the form of the teeth should be selected according to the different personality. We have the personalities such as delicate, medium pleasing and vigorous. According to this concept, the more squarish and larger teeth should be selected for the vigorous patient, whereas the small, rounded and symmetrical kind of teeth should be selected for the medium pleasing and the delicate kind of the patient. Then when we consider age, according to this concept, less profound teeth should be given for the younger patient, whereas for the older patient will give the less profound teeth. Because as age advances, you all know there will be a wear of enamel, there will be a reduction in the pulp size, and there will be a deposition of the dentine, which causes the darkening of the teeth. So, and there will be also a gingival recession in the patient. So giving very profound teeth in case of the older patient makes the denture look very unartificial. Hence, we have to reproduce all these features which I have explained to make the denture looks like a natural appearance. Then, so till now we have finished with the two considerations, that is size and form of the teeth, how to select the size of the teeth and form of the teeth. Next we have a third consideration called as a state of the teeth. So to select the shade of the teeth, everyone must have a knowledge about the physiology of the color. As you all know, the colors have 4 different qualities, that is the hue, saturation, brilliance and the translucency. So what is hue denotes? It is the specific color produced by the specific wavelength of the light. So whenever you are selecting the shade of the teeth, the hue of the teeth must be in harmony with the hue of the face. This harmony will make denture look unartificial. Then the brilliance will denote the lightness and darkness of the object, where translucency is a property of an object which permits the light to pass through it. So the natural teeth, the enamel of the natural teeth has higher brilliance and the translucency. So whenever you are selecting the artificial teeth, you should make sure that the artificial teeth also has higher brilliance and the translucency in them to make the teeth look natural. So we have few factors to select the shade of the teeth, such as the age, the gender of the patient, the complexion of the patient and the patient preference. When you consider age as a factor, we give a very lighter shade for the younger patient, whereas the darker shade for the older patient. As I explained, as age advances, there will be many changes. So we prefer darker shade for the older patient. When we see the gender as a factor, so we have to give the brighter teeth in case of the female patient compared to the male patient. As you all know, the female patients are more aesthetically concerned. Then the complexion. So the shade of the teeth should be in harmony with the complexion of the patient face. The lighter teeth are more suitable for the lighter complexion of the patient, whereas the darker teeth are more suitable for the darker complexion of the patient. So we also should give the importance to the patient preference. What you have to do, you have to show the shade guides to the patient and ask the patient to select two tabs, one is lighter and the darker, and then that tab has to be held in front of the patient lip and ask the patient to select either of the one. So this is how you are going to select the shade of the teeth using different factors. So this is all about the selection of the anterior teeth. As I told, it could be a 10 marks question or 5 marks question, 2 marks question. Thank you.